ice or heat? I'm here to settle the debate. Hi, I'm Dr. Danny Homer, the clinic director here at Peak Injury Solutions, where our mission is to make chronic injuries obsolete. And today we're going to talk about whether you should ice or heat an injury. So ice and heat all have to do with the blood vessels. So what happens when you put ice on an area is that it decreases the blood vessel size. So it narrows it down. That's actually good because what it does is it takes old blood out of the area, brings new blood in, so it can bring fresh oxygen and nutrients and really just create a better healing environment. On the other hand, what happens with heat is that it actually engorges or makes that blood vessel bigger. And so what you'll see with that is like swelling or a lot of heat. And what happens is everything kind of stays there stagnant, like a murky puddle. So that's not good because you're not creating a healing environment. So for a lot of things, when people come in, they ask ice or heat. And typically I'm going to default with ice because it's typically the symptoms have increased because of that inflammation. So we need to push that inflammation out, and that's why ice is great. So what you need to do is put an ice pack on for 20 minutes, leave it, do nothing, let it warm back up for about 40, and it's going to create that effect where it takes the blood away and then gives you new blood in that area. You can do that a couple times over, but don't leave it on for more than 20 minutes, or you can actually give yourself frostbite. Another thing you could try is some ice showers or cold showers. So you could let the ice or let the cold shower just hit you on the back or wherever that place is for like 30 seconds, a minute, until it kind of goes numb. You can't feel it anymore. That's pretty good. Otherwise, you can be really crazy and dunk yourself in an ice bath for 15 minutes. On the other hand, heat, I don't like that for a lot of things because I don't want to bring more inflammation to an area that's already trying to heal. That doesn't help it heal. So for heat, a lot of people think that it feels better when it does it, and it will temporarily feel better, and that's a whole nother video. But what you want to think about is that if it always feels good with heat, then you might have another issue going on underneath. So we address the scar tissue that accumulates in the muscles, tendons, and ligaments around joint, and scar tissue acts like glue or gum. So if you get that gum really cold, like icing it, it'll feel really brittle and stiff and it won't feel good. But if you put heat on it, it'll get really tacky like gum does after you heat it up, and it will feel good for a little bit and then it will feel bad again. And so if you find yourself always wanting to heat over and over again, it feels good, but you're only getting that small window, you should actually get checked out by a soft tissue expert to see if you have an underlying cause of why that heat always feels good, which is scar tissue. So if you have any more questions, then send us a message, leave us a comment below, or if you want to learn more about becoming a potential patient at our office, then click the link below to take to our website where you can learn more about our process and how our care is so unique and specialized. Thanks and have a great day.